You need to know this. This is important because if you're watching my content, you almost certainly take care of COPD patients. And if you take care of COPD patients, then you need to know about the Zephyr valve. Patients who are candidates for Zephyr valves are COPD patients, specifically emphysema patients. And what happens to these patients is significant parts of their lung tissue become damaged and it loses its elasticity. And because that elasticity is impaired, there's no recoil to help get gas out of those areas. And if they can't get that gas out, they start developing increasing pressure in parts of the lungs that really aren't very functional, and that pressure exerts itself against parts of the lungs that are functional. So in these patients, they place what's called a Zephyr valve. A Zephyr valve is a one-way valve. It allows air to get out of that non-functional part of the lung, but it doesn't allow gas to get in. Air can get out and fluid can get out. And what happens is that part of the lung becomes atelectatic. It essentially starts to collapse and depressurize, and it allows functional parts of the lungs to expand better and function better. These valves are bronchoscopically placed in as many passages in the lung as necessary to close off the affected lobe. And this has the potential to increase that patient's quality of life. What you need to know if you have a patient with Zephyr valves is you treat these patients just like any other COPD patient. Supplemental oxygen, bronchodilators, corticosteroids, and CPAP and BiPAP. However, this is what I want you to keep in mind with CPAP and BiPAP. A significant complication of the Zephyr valve is pneumothorax, and that's because of the way those one-way valves depressurize those lobes. When those lobes are depressurized, pleural pressure is decreased, and those lungs, those parts of the lungs, those lobes, break away from the pleural wall. Now, CPAP and BiPAP is generally considered to be compatible in patients who have Zephyr valves. A lot of these patients actually sleep with CPAP, but you need to have a heightened awareness for pneumothorax in these patients and be extremely cautious with CPAP and BiPAP if you suspect pneumothorax. Also, the patient themselves should have a resource number for you to call if you have any questions about their care in the moment.